Welcome to EAC Speaks, the podcast where we dive deep into the movement to end the HIV epidemic right here in the heart of the South, Arkansas. I'm your host, Eddie Wiley, and together we're going to explore the stories, insights, and passion that fuels engaging Arkansas community's mission. Join us on this journey as we unite voices and take meaningful steps toward a world free of HIV stigma. Now, get ready for a conversation that matters. This is EAC Speaks. Hello out there in podcast land. It's your boy Eddie, your host for EAC Speaks, and I'm excited to be bringing you another episode for our April edition of EAC Speaks, where we're always epic, empowering, preventing, innovating, and connecting, working to end the HIV epidemic in Arkansas with engaging Arkansas communities. Well, I'm excited for this episode because we get to talk about National Youth HIV and AIDS Awareness Day, which is also known as NIAD, and it was celebrated on April the 10th. And I also want to shout out the founder, Trina Scott. Hey, Trina. And NIAD serves as a platform to educate young people about HIV and AIDS, its transmission, prevention, and treatment options. And many young people don't have access to this information. And this day provides an opportunity for us to fill in those knowledge gaps. And by dedicating a day to this, we get to help raise awareness about the prevalence of HIV in its demographic of young folks. So many young people underestimate their risk or the lack of accurate information about HIV and AIDS. So we wanted to have an open discussion about HIV and AIDS and talk about youth and young adults. And what better way than to talk about HIV and NIAD than to have a representative of an organization that works directly with youth and young adults. I'm excited to welcome Miss Robin Bell. Give it up virtually, everybody. Hey, Robin.
Thank you for the welcome.
Yes. How are you doing today?
I am doing great today.
Awesome. Well, can you please introduce yourself and tell the people a little bit about your background and experience in HIV?
Well, my name is Robin Bell. I have a bachelor's and a master's in social work. I actually been doing outreach going on 12 years now. So I always did outreach, working with that underserved population and working with the adolescents and young adults that age range between 14 up to 24 years of age. And I actually started out doing HIV testing in 2015. We had the building across the street, which is a laundromat, but we call it a resource center, where we had different organizations coming in. And at that time, our numbers wasn't that high for, the early contraction of HIV and AIDS. So my supervisor thought it would be a great idea for us to just do the I Know training at Planned Parenthood. And that's what I started doing. It's a little different from the population I work with now because I never got reactive results while doing that testing over there. So now it's a little different because all the results are reactive when I get those new referrals in.
Okay, so it's you've had some different roles in the field. That's so cool, and it goes back to 2015. So tell me this: how has the landscape changed? How have you seen the landscape change since you first started?
I think there is more awareness around it, not as much as the community would like, but starting from 2015, I see more commercials, more people that are willing to talk about it in public spaces. So we have strived to, make bigger steps and bringing it to make it aware in the community. But I think we have to do more as well as far as reaching those young people so they can become educated and hear their voices.
Cool. So what are some of the challenges that you face in your role, and how do you address those challenges?
I would say keeping our young people engaged. They have to come to a lot of appointments. Some young people, they don't have that support system. They don't like disclosing their status to family. So finding ways to end those barriers so they can get to their appointments. So they can be virus suppressed. So I try to let my young people know, hey, I got a cell phone. You can call, text, FaceTime audio, wherever they would like me to meet them at. That's where I try to meet them. And it's been really rewarding. I have some that say, I don't know why I'm talking to you like you my friend. I was like, hey, whatever you got to do that we can get you to this appointment. Some young people feel comfortable with letting me know, hey, I don't like that big medical transportation van coming to my house. So we have to offer different options like Uber, a Lyft, and those type of things. So I was just saying, just meet them where they at, especially when they're not ready to disclose their status to their family.
Ooh, and so on a positive note, you kind of mentioned one of the rewarding aspects of your role. Talk to me about something else that may be most satisfying to you.
I would have to say when they call or they send a text saying, Miss Robin, I finally see my lab results. I'm U equals U, which is undetectable, untransmittable. That's very rewarding. That's where we want all our youth to be at. They're coming to their appointments. They're engaging with us. They're telling us the barriers that they have going on. So just those youth that is U equals U, those youth that are willing to tell us, the obstacles that they're having so we can help them.
Awesome. So tell me this, how do you engage with the local community to help promote HIV awareness and education?
Well, we try to work with different communities out there that's in the field. We just left Nashville actually last month with Friends for All. Going on the Hill to fight for, HIV Advocacy Day. So that was a great thing that we did. And I really enjoyed partnering with Friends for All doing that. And we also work with different organizations in the community to bring awareness. Those, those communities that are suffering real bad, the communities whose numbers are higher than others, those type of things.
Okay. So what other initiatives do you work with or do you have that you go on with?
So my coworker Elizabeth, she does C2P actually, where she collaborates and then brings different people on to just do different trainings and things like that.
Okay. C2P, I'm a former member of C2P once and forever. But yes, love to get those.
Always come back.
I always try to log in. But yes, if folks that are out there, please know that the Connect to Protect Coalition is out there. So please sign up for that. Now, let's get into NIAID a little bit. We know that you all do a lot of work with the youth. Why is it important that we talk to the youth about HIV?
I think everyone's goal is to end the HIV epidemic. So that's who we need to start with, our youth. That type of population, they don't have as much education. They're kind of blindfolded when it comes to end of the HIV epidemic, the different stigmas and the different myths out there. So I think we should start with them. That's the only way we will be able to end the HIV epidemic. They can speak for themselves. We should be bringing them to the forefront to tell us the different ideas they have and things like that. Also getting into the school systems, which is a big part that we're trying to fight for as of today, because we know there is a huge population that does need serving.
Mm-hmm. So we know that there are a lot of myths and misconceptions out there. Maybe talk to me about some of those and how you or your organization has helped to overcome those myths.
We actually have like social work supportive services and things like that. Because once our youth test positive, we have some youth who come in and say, my parents are scared, or their guardian or whoever they're residing with are scared. They tell them some, the different myths out there and things like that. So our social workers work greatly with the youth and their families to stop those different myths and the stigma behind HIV, just giving them education as well too. When I meet a person or their family in person, I like to bring information about how, HIV is transmitted and different things like that, the different myths and different facts out there that we do have.
So it's like a combined effort, not only working with the youth, but working with their parents.
Yep, that is an option for them to do emotional support with our social workers there at St. Jude.
I love that. That's amazing because most times folks get the information at home. And like you said earlier, trying to get into the schools because education in the schools may not be as up to date. It may not be as less stigmatized, I'll say, because I've heard some stigmatizing language before. So absolutely, we need to get in the schools. And speaking of stigma, so how do you address and combat stigma and discrimination that's associated with HIV in the community? I heard you mention the van may be stigmatizing or something that people can see. What are some other things that you do to combat stigma?
I would say letting the youth have a voice, hearing them out, seeing, what's their problem, what's their barriers. Why don't you feel comfortable with disclosing your status to your support system and things like that. And just, being that other support person for them as well. I'm not just here just to link you to care and to get rid of you. No, we're on this journey together. I let them know, hey, call or text my phone. Some youth phone is off, so they can only do Wi-Fi calling. That's why I say, hey, if we have to do FaceTime audio or even FaceTime, give me a call. Let me know what's going on so we can help you. We don't want you to ever be at a point where you can't come to your appointments and things like that. And I also educating them and just getting them feel with the knowledge is very important.
Yes, that's important. And it's important that we empower the youth. You've mentioned letting them know that they have a voice. So what are some other ways that we can help young people become advocates and actively participate in efforts to end the epidemic?
Well, we are actually, my manager of the community outreach team, she's actually doing an NCAB and a YCAB, which lets young people speak. They're bringing them to the forefront. So we have a mixture of just young people from different populations, different zip codes, all coming together so we can hear their voice. How do we get more young people on board, that type of thing. So I think we have to create a platform where they feel comfortable with expressing how they feel and how to get more young people on board.
Yes, like you said, offering a safe space is really important. So you talked about technology, using FaceTime, different methods that can help. How has technology played a role in your work, especially when reaching and supporting individuals in the community?
When COVID-19 hit, I would say technology played a huge role. We have to think of different innovative ways just to reach their community and to keep them engagement numbers that were still up. Most people didn't know, how do I get COVID-19? So it was kind of something like you did when HIV came out, how is it transmitted? It was the we don't know type of thing. So technology played a huge role. We was able to get together with different community partners just to come up with different creative ideas to keep that engagement going on, like offering different trainings online, those type of things, spreading the word about PrEP and PEP to different physicians and things like that. So technology plays a huge role. I think that's where our young people is at. So we have to become more tech savvy if we want to reach them.
Absolutely. Now, what about social media? Is there an importance of using social media?
Definitely. That's where all our youth are at. I'm not that good at TikTok. I watch the videos, but that's where most of our youth, young people are at, social media. And I like to ask my young people, where did you meet your partner or where do you meet this person? And majority of the time it is on social media. So I think we have to have a bigger presence on social media.
Oh, absolutely. Organizations, advocates, all types of folks in order to reach people. I think, especially the youth, folks are always asking, how do I reach the youth? How do I reach the youth? They're on social media, whatever platform you think they're on, they're absolutely on. It may not be as much on Facebook, but you can find them on TikTok.
Yeah, definitely find them on TikTok and Snapchat.
So in your opinion, Robin, what are some of the most pressing issues that you feel like we're facing in HIV advocacy today?
I would say education about HIV and AIDS. A lot of people don't know how you get it transmitted. A lot of people are scared to talk about even in their households. I know when I was growing up, all I was told was, hey, you have sexual intercourse one time, you can get pregnant. Nothing about STDs, STIs, or even about HIV. So I think we have to be more acceptable with talking about the stuff that we don't know. It's okay to educate ourselves when we don't know something. It's okay to spread the knowledge that you have. So I think that's the most pressing issue. Everybody is afraid to speak up, especially if they don't have the knowledge about something. So they kind of go with different myths and things like that. That's how all those myths and different stigmas are built up because of the I don't know.
Yes, I love that. You spoke that perfectly. I always say spread education, not stigma. So absolutely, absolutely. Now let's talk about the future of HIV. How do you see the future of the HIV field evolving? You know, we have the goal of ending the epidemic by 2030, or, you know, we got the NHOS by 2025. But how do you see the future of the HIV field evolving?
I think we have made great progress. You know, we went to multiple pills to one pill with or without food to actual injectable medication. So I think we're making great strides, even though there can be more done, like the education. If we don't reach our youth who are suffering greatly by the numbers I have seen last year, especially, we won't reach our goal by 2030. Our youth are suffering severely, and those are the population that we do have to reach. So I think we're striving for, you know, progress, because where we come with medication and, you know, with high hopes and with all the technology and different scientific things going on, maybe we can get to a point where it is curable. But we still, while we're waiting on that to happen, we also have to educate.
Absolutely. Education, getting hip with the trends of what's going on in the field. Like you said, we've gone from many medications to just a few, and now we have the injectable. So I'm shout out to the Cabby Never. No, we're not getting paid for that, so never mind. But yes, the injectable is something that I'm really interested in learning more about. There is so much information that's out there. I don't think a lot of people even know that there's a such thing as the injectable. So getting that awareness out there of all of the things that are available, like you said, PrEP, PEP, the Doxy PEP, all of these things are really important for us to spread information about.
That's one of the things I try to lead when speaking with my youth. They like, so I got to take a pill for the rest of my life. I got to take a pill every day. And I have to let them know, once you stay consistent on your medication, if you would like, you can switch to that injectable so they can see like a light at the tunnel. You don't have to take a pill every day. You just come in for your injectable, whether it's 3 months or 6 months, and you can go on living your regular life. So that's what I like to mention to our youth, because taking a pill every day is hard for me, taking allergy medicine every day. So I can only understand when a youth taking medication every day, especially if their guardians or parents is not aware of it. So now you have to find when it's a good time to take your medicine. Where can I hide my medication? So I like to lead with the progress we have made towards the injectable so they can see a light at the tunnel.
I love that, Robin. And it's been a light talking to you. Now tell me, what activities do y'all have coming up? How can folks reach you? Where are y'all on social media?
We're actually at the N901. You can find us on IG and Facebook. So that's NEED HIV and 901 on IG and Facebook. We're treading a little slow now because, Pride Month is coming up. So we're gearing up, ordering our different incentives and getting ready for those type of things. So we plan on attending Tri-State Black Pride as well as Mid-South Pride. Speaking back towards our ATN, our youth cab, they actually have an opportunity where everybody who has a youth cab has the opportunity to create a poster. So we're bringing our youth to the forefront so they can come up with different ideas, and they have given the opportunity to put whatever they want on the poster to catch the eye of young people. So we're working on outreach efforts and what has been done in the year. So our youth are working on that. And then we also have C2P coming up, which will be April 17th. And you can RSVP at connect to protect at stjude.org. or you can just give Elizabeth Prost a call. I'm pretty sure everybody has her number. So just send her a quick email or just give her a phone call. And if you want to reach me, you can reach me through email, robin.bell@stjude.org, or call me personally. I'm always answering my phone, 901-857-7783. If you just want to chat, if you know someone that needs to get in care, just give me a call.
Awesome. And we thank you, Robin, for coming on EAC Speaks. I'm glad it wasn't that much of a
No, thank you for the invite. It was a joy speaking about the different efforts and the pressing issues that we have with young people today, and just getting the word out and the education about HIV.
Awesome. Well, do you have any parting words for our listeners today?
Don't be afraid. Get tested. Know your status.
Yes, know your status. Get on out there. And especially if you're in the Arkansas area or if you're in the West Memphis area, St. Jude's right across the street. You ain't got to go too far in the area. So please reach out to Robin, especially her colleagues. Follow NHIV 901, the C2P Coalition as well. And we'll stay tuned for the next episode. Say ciao, Robin.
Ciao.
Ciao.
The EAC Speaks podcast is partially supported by the Arkansas Department of Health through a grant funded in part by the CDC. All discussion is solely the responsibility of each participant and doesn't necessarily represent the official views of Engaging Arkansas Communities, the Arkansas Department of Health, CDC, or the U.S. government.